Hello friends, hope you're all okay. You're all enjoying your life. You're also enjoying watching my videos. You're all very focused, very dedicated, and you always try to give your best to the general public, and you try to enhance your knowledge to help the community at large. Today I'm going to discuss about one of the tumor, that is a medulloblastoma. Medulloblastoma happens to be very aggressive tumor. The second thing, it involves the posterior fossa, and it is also called as a peanut of the posterior fossa. It usually involves the roof of the fourth ventricle. It appears to be a midline cerebellar mass, and because of the compression effect, it causes hydrocephalus. It's usually seen at the peak age of 7 years with the male predominance. At the time of presentation, it one-third of the cases are presented with the intracranial dissemination, with the intraspinal dissemination, and even with the subarachnoid dissemination. How we will be able to appreciate on the non-contrast CT images, on the MR. So this video will particularly involve all these information, and I do hope you will love that video. Let's start watching these images. On this axial CT images, you can appreciate a well-defined hyperdense lesion. That's because of the higher cellular density, midline Vermanian mass abutting the roof of the fourth ventricle. So this is what the medulloblastoma will look like. You can also appreciate the perilesional edema, which is quite visible on that image. Beside this, in this case, you cannot, however, appreciate clearly any cystic changes or any hemorrhagic or any calcification within it. And the next point is that associated hydrocephalus is also seen. So far the brain stem is concerned, it is displaced or pushed anteriorly. So this is what the medulloblastoma will appear on the CT images. Another example of the medulloblastoma, particularly involving well-defined hyperdense lesion in the midline and abutting the roof of the fourth ventricle. Also, you can appreciate a significant amount of the perilesional edema. Hydrocephalus is also associated with, however, no cystic changes, no hemorrhage or no calcification especially seen in that case. So far the brain stem is concerned, it is displaced anteriorly. So this is how the medulloblastoma will look on the CT imaging, and this is the tumor of the childhood. Again, a childhood tumor involving the posterior fossa, hyperdense, well-defined, associated with perilesional edema. So there is surrounding edema because of the compression effect. However, no particular calcification or intra-tumoral cystic lesion or hemorrhage can be seen. You can appreciate that there is also hydrocephalus which is associated with that. So far the brain stem is concerned, it is displaced anteriorly. Another example of the medulloblastoma being well defined, being hyperdense, being midline Vermanian, involving posterior vertebra and posterior fossa, and it is also abutting the roof of the fourth ventricle. Perilesional edema is quite common. Surrounding edema is visible here in that case. To some extent there is calcification present in that case, and so far the brain stem is concerned, it is displaced anteriorly. A quite clear example of the medulloblastoma, hyperdense lesion causing hydrocephalus, midline lesion abutting the roof of the fourth ventricle, visible here, associated with the hydrocephalus. Surrounding edema is also visible, and so far the brain stem is concerned, it is displaced anteriorly. So this is what the medulloblastoma on the CT images. Medulloblastoma happens to be an aggressive lesion and usually seen in the child age group, especially in 7 years of age and male with a male predominance. And you can also see this in adult age group as well. On the CT images it will appear as a well defined and hyperdense lesion, which you have already seen in that case, and it's midline and associated with the perilesional edema, and there will also be a hydrocephalus, cystic changes, hemorrhagic changes, and calcification may also be seen. So I do hope medulloblastoma will be easy for you to understand and to recognize on the CT images. So keep watching my video, keep sharing with other, and keep sharing the informations as well with some new information in the next video. We'll see each other. Take great care of yourself. Bye bye.